What do we do the very first time we have a patient, a new person that asks us what we're doing, what we do for a living as dental professionals? Quite frequently, the reaction is, I hate going to the dentist, because up to 80% of Americans do not like going to the dentist and are fearful, and that number gets bigger worldwide. And that means that when patients come into our office, they're already in pain in their brains before they even come back to see us. So why is that? Well, let's take a look at a dental visit from the patient's perspective. We bring the patient into our beautiful reception areas, hopefully a short wait, up back to the treatment room. We sit them down in our nice comfy chairs. We put on a beautiful napkin, but this is not an ordinary napkin. This napkin has a thick plastic backing, and we clip it on with clippers to make sure it stays right where it's supposed to be, right? Then we put them back in the chair, and just as they're about to get comfortable, we shine a big, bright light right into their eyes. And as they begin to look up, what do they see? They see shadowy figures emerging from the light. And they don't even look human. They've got big googly eyeballs looking down at them, They've got a mask. You can't even tell if that's who you think it is back there. And then they start to wield sharp and scary instruments like probes and explorers. They shoot you with little needles that leave your lip numb and your speech slurred. But the worst is yet to come, because out comes the drill. And what happens is you're laying there trying to see in the light. All of a sudden you see pieces of your body, the dust of your teeth flying up into the air and landing on that perfectly placed napkin. Because you see, they all knew what was going to happen, and they agreed to it because they want to keep their teeth for a lifetime. But what they didn't agree to is any conflict or grief or emotional turmoil present in the office, which they can pick up in a heartbeat. So, what do we do about that? How do we keep our offices harmoniously working? The first thing we need to do is build our most important clinical asset, trust. We need to assess trust on a regular basis. We need to build it with every encounter and every single patient. And we need to connect with our patients by listening to them attentively. Trust is so important, it affects every single thing we do. Back in 2000, I was working on a formerly fearful patient. I'll call him Bill. And he was laying back on a really nice summer day. He was nice and comfy. He had the video glasses on. He was watching his favorite movie. We were doing a root canal. We were doing a rubber dam. He had the rubber dam was in place. And I was just going after that last little canal. And I was rinsing it out. And all of a sudden, the tip of the syringe flew off, hit the glasses, but the bleach found that little space between the rubber dam and the glasses, and I dumped an entire syringe full of bleach into Bill's eye. What did we do? Well, my assistant, I'll call her Sue, and I jumped up. We ran to that eye wash, and then Sue took Bill over to a local doctor's to take care of the problem. I went back into my operatory. I was just dying. I was in agony. What have I done? I have hurt someone. I blinded Bill. I was sure. What had I done to his life? And I realized, of course, that being blinded by bleach is not on the consent form. So we should rethink that. Anyway, I was back for a while, and then Bill and Sue came back. They came back to the office, and I went up to the front to greet them. And I was horrified with what I saw. Bill was at the front desk. He had a patch on his eye. It was bloody. There was blood dripping down from the patch. And I went out there, and I couldn't speak. What had I done? I must have looked terrible myself, because in just a couple of minutes, Bill started to grin. And then Bill started to laugh. And then Sue started to laugh. The front desk area started to laugh. The patients in the waiting room were laughing. I was not laughing. I was a little confused. As it turned out, Bill was fine. The doctor that I sent him to was a friend, and he thought could use a little humor in this situation, and he did some creative patching to Bill's eye. But in reality, this turned out great, because I had spent many years building trust with Bill, from a fearful patient to a content patient. I had spent many years building my relationship with Sue, my dental assistant. They trusted me. Had that not happened, things could have turned out differently. Sue could have told Bill on the way to the doctor's office, this is the third patient she's blinded by bleach this week, right? And Bill could have maximized his injuries instead of minimizing them. So by building trust and doing it intentionally every day, we built this situation so that instead of a malpractice claim, it was a bonding experience for all of us. But what happens when the pain is in the brain of a team member? I've been through a lot of experiences in my life. I've been through my share of emotional turmoil. But on January 31st of 2009, my world shattered into a million pieces when I lost my beautiful, kind, caring, compassionate only son, Eric, to suicide 45 minutes after his girlfriend broke up with him. Eric was a brilliant student. He was an engineering student. He was on student government. He was a brilliant jazz pianist at Columbia University. He had this life ahead of him. Eric was a victim of suicidal depression, a brain not quite fully developed in the area of critical thinking, and also his innate impulsiveness that made him such a good pianist. And this was not my first brush with suicide. I lost my mother, Anne, to suicide when I was 17. And I lost my nephew, Zachary, to suicide 2 years just before Eric. Suicide runs in my family. I've experienced that deep, dark, suicidal depression pit myself. I know how it feels. When Eric died, I couldn't eat, I couldn't sleep. I felt as if I couldn't go on, but I had to go back to work. How can I stand up and take care of these patients who are going to know when there's something wrong if I can't even get out of bed, if I can't even stand up? These are the times that test the entire team. We need to start to develop strong preparedness measures to handle emotional emergencies, just like we do medical emergencies. Because right now there are many emotional emergencies happening. People are going through this all across the country right now. It's going to happen to you. We need to write them down. We need to keep them in a handy place. We need to put the emotional emergency procedures in our policy manual, and we need to even keep them in a handy place so we have them. We need to write it down and prepare. Wouldn't it be great if the next time someone came into your office with cancer or who had just gone through a divorce, you knew exactly what to do and the whole team would take over? Wouldn't it be great if the next time your team member suffered a loss and came to the office and you could gather around him or her and stand beside her and help her get through the day and make sure the patients had a good experience? Calamity and catastrophe are going to happen to all of us. They're right around the corner, and we have no way to control that. What we can control, however, is how we prepare and how we cope and how we manage and how we heal. Every office needs an emotional emergency guide so that the next time disaster strikes, you're ready. And we need to make preparedness and trust our number 1 and 2 best practices. Thank you.